Hello everyone, I am Dr. Andrew Shu Lee. Today, we will discuss a topic that challenges conventional wisdom. Healthy medicine, from prevention to reversal. Is it truly impossible to reverse the process of birth, aging, disease, and death? In fact, over 20 years ago, scientific literature confirmed that there is a simple and safe method capable of reversing cardiac remodeling, which entails reversing disease and aging, that is, healthy medicine. In other words, we can not only prevent disease, but also make the body stronger and more youthful. This method is called cardiac preconditioning, abbreviated as RIC. What is RIC? Let us first break down this term. Cardiac preconditioning may sound academic, but the procedure is actually quite simple. It involves applying pressure to the arm with a blood pressure monitor for a few minutes to temporarily stop blood flow. Then releasing the pressure to allow blood to return, which activates the body's protective mechanism, enabling vital organs such as the heart and brain to better withstand potential ischemic damage in the future, such as myocardial infarction or stroke. This approach is known as indirect cardiac preconditioning because it does not directly stimulate the heart, but instead trains the entire body's immune defense system through the arm, considered a remote area. The RIC method is precisely a modernized and scientific approach to health preservation. What is cardiac remodeling? Let us first explore the concept of cardiac remodeling. When the heart undergoes stress or injury, it initiates a compensation mechanism, modifying its shape and function to maintain its operation. Potential changes include thickening or thinning of the myocardial wall, ventricular dilation or abnormal contraction, decline in both systolic and diastolic functions. These changes initially act as compensatory mechanisms, but over time, they may cause the heart to weaken progressively, potentially leading to heart failure. The possibility of reversing cardiac remodeling. So, is it possible to restore the heart to a healthy condition? The answer is yes. This process is known as the cardiac reverse remodeling. Indicators of reversal include restoration of the myocardial wall to its normal thickness, restoration of ventricle size, improvement in heart function and reduction of symptoms. This signifies that the treatment not only manages the condition, but truly makes the heart healthier. The RIC method is one of the clinically proven effective techniques. RIC. How does it influence cardiac remodeling? The effects of RIC on the heart include reduction of cardiomyocyte apoptosis and fibrosis, enhancement of left ventricular ejection fraction, LVEF, promotion of microvascular regeneration and metabolic remodeling, reduction of ventricular dilation and abnormal wall thickness. These changes are concrete manifestations of the reversal of cardiac remodeling. How does RIC promote reversal? RIC is a non-invasive physiological intervention technique. This process stimulates improvement of endothelial function, activation of antioxidation responses, activation of stem cells, and enhancement of repair capacity. These reactions not only protect the heart, but also delay aging and improve chronic diseases. RIC and the reversal of aging. You may ask, what does this have to do with aging? In fact, cardiac remodeling is a common feature of both aging and chronic diseases. Hypertension, coronary heart disease, and heart failure all gradually cause the heart to deform and lose function. The RIC method can enhance microvascular function, reduce oxidative stress, improve cellular repair capabilities. Therefore, RIC is not only a therapeutic tool, but also an anti-aging physiological intervention technology. So, can RIC promote health preservation? The answer is yes, and an increasing number of studies support its potential in health preservation. RIC advantages include safe, low cost, and non-invasive, can be performed at home, provides protective effects for the cardiovascular, metabolic, and nervous systems. Simply put, RIC is a scientific health preservation method that activates the body's self-healing ability. It relies neither on medication nor supplements, but on the body's inherent wisdom. In summary, cardiac remodeling is the central pathology underlying disease and aging. RIC is a technique capable of reversing this process. It is simple, safe, scientific, and suitable for both clinical practice and home health preservation. It represents a new concept of health, We do not merely treat disease, but proactively repair and delay aging. You may believe that aging is natural and disease is predetermined by fate. However, modern medicine and molecular biology have long confirmed that disease and aging are physiological processes subject to intervention. We can choose reversal rather than passively waiting. Today, I will introduce you to a completely new health paradigm: healthy medicine, actively reversing the programming of life. Disease and aging are not inevitable. Let us first clarify a common misconception. Do you believe aging is natural? In fact, it results from your choice to remain inactive. Disease does not arise suddenly. It accumulates over many years due to a lack of health preservation. Aging is not inevitable. It is a physiological process that can be reversed. Healthy medicine is not about merely prolonging life, but about reversing decline. What will happen if we do nothing? Chronic inflammation persistently damages cells, leading to diabetes, cardiovascular disease, and cancer. Metabolic imbalance and hormonal decline accelerate muscle loss, osteoporosis, and cognitive decline. Cellular aging and telomere shortening lead to gradual organ dysfunction. This is not natural death, but pathological death. How science reverses the life program. The good news is, we can reverse it. Modern medicine has identified numerous methods to reactivate the body's self-repair capabilities. Exercise can activate muscle hormones, myokines, such as irisin and BDNF, promoting neural regeneration, fat metabolism, anti-inflammation, and anti-aging. Intermittent fasting and caloric restriction activate autophagy and longevity genes, such as S, I, R, T1, eliminate damaged cells, and delay aging. These practices are not merely health maintenance, but scientific actions to reverse pathology and reboot the body's life program. Neglecting health preservation allows aging and disease to silently erode life. You can choose reversal. We do not passively succumb to aging and disease. Rather, we choose reversal. This represents both an attitude and an action. Every exercise session, every fasting session, every RIC training session reboots your life program. Conclusion: the future of health preservation medicine, healthy medicine. In summary, disease and aging can be reversed. RIC is one of the most promising techniques. We are not driven by aging and disease. Rather, we choose reversal. It is not about extending lifespan, but rebooting life. Health preservation is the choice to reverse aging. Healthy medicine is not merely healthcare, but a conscious choice to reboot life. Healthy medicine is a proactive health philosophy. Disease does not occur suddenly. It results from years of accumulated neglect in health preservation. Aging is not fate. It is a physiological program that can be reversed. Thank you all for watching. I am Dr. Andrew Ingshu Lee. Website is www.heartdisease.idv.tw. See you next time.